Hi, everybody. My name is Donna Steele, and my partner here is Kelly Liscum. And our case study presentation is on Maggie. We'll just jump right in. So, some background information about Maggie. She is an 8-year-old female. Originally, she and her family are from Yemen. They were displaced due to the ongoing war there. She happened to be separated from her grandparents, who are currently still in Yemen, and she's still learning English as she just arrived in the States this fall, and her English is very broken at the currently. She's very sensitive to loud noises and has recently become more aggressive when she's feeling triggered by loud noises. Highly impactful or traumatic events that have happened in Maggie's life. She witnessed a lot of war crimes and thereafter the bombing aftermath of that in her home country of Yemen. She had food insecurities due to food crises as a result of the war. And unfortunately, her grandparents were not allowed to move to the US with her family, and they had to stay in Yemen due to their medical conditions and age. And then lastly would be the language barrier, as Arabic is her first language, and she's now in America and trying to learn English. Some strengths about Maggie is that she's very resilient. She's kind to others. She has friends in her class, despite the language barriers. She's still able to kind of communicate and at least show that she wants to make meaningful connections with others. She's respectful to teachers, and overall, up until these aggressive behaviors happen, she's been very cooperative in the classroom.
So, some additional information about Maggie and her family. Because war was a part of their daily life, her parents did not associate its traumatic effects with her behavior. So, um, they didn't even mention that it was a traumatic event because they were so conditioned to seeing what the war was and how it affected other people. Um, Her grandparents, especially her grandmother, as Donna said, they had to stay in Yemen because of some medical conditions, but her grandmother, especially, she was very, very close to. And they'd lived with the family since before Maggie was born. So being without one of her primary people um, for a great amount of time has really started to affect Maggie's mental well being. And she also has aggression due to the flashbacks that she saw from war crimes and things that she saw every day while she was in Yemen, things that had to do with um, bombing and war and aggression towards others. So she was starting to have some of those flashbacks, and they were starting to be to promote aggressive behavior from her. So we wanted to explore whether CBT or cognitive behavioral therapy would be, when it's provided from a trauma lens, if it would be effective for children with post traumatic stress disorder as compared to other treatment options. So what we really wanted to do was reduce her behaviors, but we also want to manage her behaviors. So Maggie's symptoms included the aggression with physical violence, and that was acute onset. She did have a couple of instances where she attacked her family members with a pair of scissors. Destruction of another's property during a lockdown drill. She had taken one of her classmates' book bag that was hanging in the back of the chair, and she had um, tried to destroy it. She has sensitivity to noises that create a state of panic when experienced. So the noise from the lockdown drill really triggered something, and that's when she really has her aggressive behaviors. And then she did have one incidence of kicking the family dog, but it was determined later that it was while she was having a flashback. So it wasn't intentional, but it was still something to kind of keep in mind. So we carefully explored Maggie's symptoms. We used the DSM and we determined that she met diagnostic criteria for PTSD based on the fact that she witnessed a traumatic event. She does have intrusive memories that exacerbate stress, especially when triggered. So going back to the lockdown drill and the noise from that, that really triggers those panic attacks slash aggressive behaviors. She experiences flashbacks and reenacts scenarios of the original trauma. So going back to the example of the classmate's backpack, she felt that there was something wrong with it because in her during a flashback in her mind, when a backpack is left unattended, it usually means there's something wrong, something in there that's going to hurt somebody. She has increased reactions related to the traumatic event that included physical aggression. So it was an elevated startle response, concentration and sleep disturbances, and hypervigilance. She's always looking around, always, on edge, making sure that everything in her environment is safe for her. We did rule out all differential diagnoses, and all other medical conditions were ruled out. And the big thing for the PTSD is they were contributing to decreased functionality at home and in school, as well as interpersonal and social relationships. So not only did she have the language barrier to exacerbate the broken social relationships, she also has the uh, the symptoms of PTSD that are interfering as well. So for her treatment plan, our primary focus was symptom management that will lead to symptom reduction. So we really wanted to make sure that Maggie could effectively manage her symptoms, but also we wanted to see a reduction in symptoms. So we needed interventions for the acute symptoms. So a lot of that was learning some techniques that she could use in the moment for when she was having some fear, some anxiety, things like that that are associated with PTSD. But we also wanted to have a behavior modification plan in there that will not only address the acute symptoms, but also ongoing management of her symptoms. So a lot of that was working on emotional regulation skills, teaching her that in the moment, using some mindful and grounding techniques to be able to get her emotions in check so that she's able to use her judgment and reasoning and problem solving and thinking skills. Um, Hopefully those skills would not only lead to symptom management, but it would also lead her to have a reduction in symptoms. Um, and we wanted to make sure that that was going to work for her. So we decided to use cognitive behavioral therapy. So that helps with the development of emotional regulation skills. We used mindful techniques. So for the acute episodes and to maintain the emotional regulation for ongoing. In trauma, if you have a client that has heightened arousal, you want to address that before you address the behavior modification. So we have to help her learn how to manage her emotions when she's really highly activated before we work on behavior modification techniques, because one has to come before the other for them to be effective. We also address maladaptive behaviors. So when she was conditioned to react to loud sounds, we're working on desensitization for her so that she can hear the sounds and not have a flashback or have an aggressive behavior episode. And it also helps with development of social skills to address social and language barriers. So she's working with a teacher to help more with learning English a little bit better so that she's able to communicate more effectively. But she's also developing social skills to be able to collaborate and be in a cohesive environment with her peers. And we have found that CBT has produced success in treating PTSD symptoms. So it's really effective for Maggie to have this type of a treatment or approach.
Yep. And like Kelly was saying, that it really is kind of twofolded because of the language barrier and kind of getting Maggie to be able to identify those feelings and emotions in her first language, as well as learning those feelings and emotions in her second language. So it's not going to happen overnight, but it's definitely doable. And this brings us to our conclusion and professional insight. So some remaining questions that we had were, are the memory gaps due to like a disassociation? Um, did Maggie not remember things because she kind of disassociated due to the trauma that she was experiencing? And we are also thinking about, will puberty affect her neurodevelopmental path? Will aggressive behaviors heighten or worsen or lessen based on her hormone levels and things of that nature? Um, and how do we measure one's readiness to remember? So do how much do we push her in her therapies and sessions with us, once she has a language and understanding of it, to see if she is able and is ready to remember those events, and if and when that time happens. And then some Oop, further recommendations. We we need to build a trauma timeline from birth. So figuring out if there's anything else. So we know that she experienced a lot of war crimes and some horrific things when in Yemen, but we don't have a lot of specifics. And we only went back so far. So I think we would need to develop that from birth. We need to recognize that PTSD affects the whole family system. It's not just Maggie. So whether her parents acknowledge that they went through a traumatic event or not, it does affect the whole entire family unit. So focusing on that as well. And we would recommend that the following adaptations for Maggie would be perhaps using a therapy dog for school use, that if there was a triggering event that they could go um, and we'd be able to call the dog and they'd be maybe sitting on Maggie's lap on the ground to give her comfort and just provide that emotional support and regulation. We could suggest a sound sanctuary for the school. So creating a room that is completely soundproof, kind of like maybe that an audiologist would use, that during the lockdown drills, she has somewhere to go. She could also use noise reducing headphones as to when an alarm, because sometimes it's not a drill, sometimes it's a fire alarm that's really happening and we're not aware that it's going to happen. So having those headphones on while we take her to the sanctuary or we'll take her out of the building if needed. And to facilitate a crisis plan with input from Maggie and her parents and the educational team. So this would be something that would keep her safe as well as everyone else safe in the room, because we don't want her aggressive behaviors to escalate to a point where she's hurting herself or others. And then we would emphasize that intervention take time. So if we were to conduct a behavioral assessment, a functional behavioral assessment, it takes many weeks of observation to figure out what the function of her behavior is. And then after that, creating a behavior plan to address those behaviors and how we as staff respond to those behaviors. It takes time. So interventions are not going to be a one-time fix and we fix everything. It's going to take many attempts, and that this is going to be a long process, and it, that we all have to be kind of patient and give ourselves and Maggie grace during this time. And here
Right.
are references that we used. And that's Maggie.
So we look forward to answering any of your questions and thank you for listening to our presentation.
Thank you.
Whew.